I'm Padma Chari, Executive Committee member of ICA, and I have been involved with ICA for a few years now. Many of you are familiar with ICA, Indians for Collective Action, but some of you who are not, I will just take a few minutes of your time to share a little bit about ICA. Since its inception in 1968, ICA has nurtured social activists and helped spawn organizations like ASHA for Education and Foundation for Excellence. And it has supported community led development projects in over 20 states in India and dispersed over $5 million, dollars, a lot of it in the last decade. ICA believes in a secure life for every Indian in a sustainable environment and a just society. The mission is to support sustainable development in India by partnering with dedicated NGOs and individuals. Some of the goals include providing seed funding and support for NGOs, enabling inter NGO collaboration, and involving local US communities in its work. The priority areas include poverty alleviation, watershed projects, and community health and welfare, women's empowerment, the environment, and of course, many, many more important aspects of life. In the last 12 months, as a routine function of ICA, we have dispersed close to $2 million dollars to 70 plus projects in India and 5 projects in the US. But ICA also engages with the community with special groups, small groups, and for areas, special areas of focus, works with special initiatives, hosts an annual event, and the quarterly forum. So amongst the events that ICA hosts, the forum is unique in its own way. The idea of ICA Forum is to engage the ICA community of Indians and ICA supported NGOs, as well as its partners and members in the exchange of ideas and best practices. Our goal is to connect the ICA community, to inspire, learn from subject matter experts and NGO leaders, and motivate the community. The goal is to share best practices to overcome barriers, manage significant issues, and discuss lessons learned. This brings us to today's topic, COVID in India, understanding the trajectory and how you can help. So far, we have at ICA raised over $50,000 during the first wave, March, April of 2020, and donated these funds to 16 NGOs in India to provide COVID-19 relief work. The work involved rations, cooked meals during the lockdown phase, assisting migrants as they traveled far distances. And during the second wave, ICA has raised approximately $175,000 for COVID relief work in India. We are working with 20 plus NGOs in different parts of India to carry out this relief work, more so with marginalized, overwhelmed areas and remote tribal villages. And the NGOs are using the ICA provided funds to distribute washable cotton masks, reusable masks, oximeters, thermometers, cooked meals, dry rations, oxygen concentrators, and the items needed for immediate help with this situation. So one NGO is even providing rations where the person gets COVID vaccine as an incentive. Going forward, our focus will shift more towards the prevention by providing washable masks and vaccination incentives. So once again, looking forward to this fantastic event today. I would like to introduce and call upon our president, Reshma Nigal, to introduce our speakers. Please sit back, enjoy, post your questions in the chat. Please mute yourselves unless you are speaking, and let's have a great event. Thank you.
Hi, everyone. Welcome to the ICA Forum on Understanding the Trajectory of COVID in India. ICA has created this forum, like Padma mentioned, for the exchange of ideas and to share best practices. It has been very successful during this very, very tragic year and a half that we've had, where we've been able to bring attention on the work the NGOs have been doing and the work that NRIs have been doing in helping India and Indians who are suffering. This COVID crisis has affected not only each family, each community, each country, but it has actually affected the whole world. And it is not something that anyone is going to forget in our lifetime. I have two grandchildren who are 8 and 5, and for them, wearing a mask has become standard, and the 5-year-old does not even remember when she was not wearing a mask. In fact, when we first held our pandemic forum, India was going through the mass movement of laborers who were trying to get home, and ICA played a part in helping our NGO partners with this crisis. Since then, all our forums have addressed this issue, but of course, nobody expected what the second wave was all going to be about. So, to help decipher the economic impact of this crisis and how it is impacting the communities in India that we hold so dear, we have an eminent group of individuals who understand the crisis we are facing from the grassroots level and the government's perspective, as well as from the medical angle. So it gives me great pleasure today to welcome Consul General Dr. Nagendra Prasad. Welcome. Uh, Dr. S.V. Mahadevan, Stanford University, and Art Forum moderator today, Dr. Priyanjali Datta, who's logging in from India. Welcome, all of you. Thank you, Padma, for putting this together, and thank you to the executive team who's worked very hard to make this happen. This trio today will help us understand the COVID situation and give us practical advice on what we can do from here, because each one of them has been involved with the crisis and understands the methodologies, the policies, the procedures that are working, not working. Before taking over as Consul General of India at San Francisco, Dr. Nagendra Prasad served in the Ministry of External Affairs as Joint Secretary heading the Gulf Division. He joined the Foreign Service in the year 1993 and served in various positions at missions, including Tehran, London, Thimphu, Bern, Ashgabat. He was India's ambassador to Turkmenistan from 2014 to 18, and we look forward to his advice on how we can help. Dr. Mahadevan is a professor of emergency medicine at Stanford University School of Medicine. He was the ED medical director and associate chief from 2000 to 2012 and served as the founding department chair in emergency medicine from 2015 to 17. He has been traveling back and forth to India during this crisis and helping people there and here. Dr. Mahadevan currently serves as Director of Global Affairs and Strategy for Stanford Medicine and Stanford Healthcare and the Director of South Asia Outreach Center for Asian Health Research and Education. Dr. Priyanjali Datta is the founder of Aarogya, established to serve women's health and wellness in India. As with every NGO, she too has pivoted to working with COVID relief. A doctor and a model turned serial entrepreneur, she started Aarogya International at the age of 19. Her zealous, infectious zeal and hard work have made Aarogya reach almost 3 million women across rural India and now even Uganda. Congratulations. So without much ado, I'd like to introduce our moderator and welcome her and welcome our speakers. This has been a great honor. And a big welcome to the ICA community who always logs in and is always interested in what we have to say. So thank you very much, all of you. And I'll chat back again after this is over. It's all yours, Dr. Datta.
Thank you, Reshma. First of all, thank you so much to ICA and Team ICA for giving me this opportunity today to speak to two eminent people who have worked for India during pandemic and even before, and they have immense experience about what to do, what went wrong, and what can be done in future. So it will be a great learning experience today for me and for everyone here to learn from them. A very good morning from here in New Delhi, and very good evening to everyone there in California. So, my first question is for Honorable Consul General, Ambassador Sir. I would pose this question, which is, I think, very important for all of us to know from you. What are the obvious bottlenecks in COVID relief that is being undertaken in India?
Thank you very much, Priyanjali. Thank you, ICA, for organizing this. I just heard from Padma what all good work you have been doing as part of ICA. I must mention that during the first wave, I was in India. We were tackling a different issue, getting people from abroad to India, particularly from Gulf and from various other places, including US. And the first wave, we could manage very well, and then there was lockdown, as Ms. Reshma Nigam was mentioning that there was some migration of laborers, etc. But it could be contained and then managed with all the support. But no, in the second wave, I think no robust healthcare system can take care of or manage such a surge in the infection, which people were predicting about X, and then it became 4X kind of thing as per the experts. So that is how the health system, healthcare infrastructure has got strained to take care of this many cases. That has created a most difficult situation. I think, as our Honorable Prime Minister mentioned, it is the worst case scenario in the history, in a century. So that is what we are going through. See, we don't look at what went wrong or something. No, we are at a stage where we have to control the infections, etc. We have been in US. You saw that our relations are very, very strong, and then Prime Minister spoke to President Biden thrice, and then our Honorable External Affairs Minister was in US. No, it's all true. No, it's a global pandemic, and until and unless everyone is safe, the global community is not safe. That is the basic point. So based on which we have been in consultations with them, and as we speak, the numbers are coming down. Infections, I think, Priyanjali will be the best one to tell, from India, and we are also looking at, there is a bit of temporary gap to bridge. That is vaccines supply. That's what is being done, how to source these vaccines for this temporary gap. We have to bridge that. I believe every expert. Other day I was on the other panel. Experts like Dr. Mahadevan, or even Dr. Fauci was there on that. See, the conclusion was that yes, you have to vaccinate the maximum number of people during this period so that there are no mutations. There are the third wave will not be as drastic as the second wave. So that is what the idea is. I think from here we were working towards sending medicines like remdesivir, etc., from Gilead, and then later on we got into this amphotericin, and then the tocilizumab. These kind of medicines were required, and then we were supplying from here. thanks to everyone in this community, who have helped us. There is no day when I have not received a call or mail from the community, very vibrant community on the West Coast, to send some materials. I don't know how many thousands of the oxygen concentrators, oxygen generating machines. And now the community was so passionate. People were asking, no, I want to set up a oxygen generating equipment in particular village in Gujarat, in particular village in Andhra. So they were all very passionate about their work. Recently, I saw some physicians from Stockton got together and then sent about 700 concentrators to Hyderabad. So people were working from various quarters and then they were doing their bit. It's overwhelming support. We all thank everyone from core of our heart. See, the bottlenecks were maybe in the beginning, when the relief materials were reaching, but later on the government has streamlined it and things were leaving. I can tell you one example of last week wherein 650 concentrators gone. It went very smoothly. The agencies are there, the officials are there, and then the clear guidelines on exempting the customs duty, GST, everything is there. We have been sharing with them and it had no issues. So basically what we are looking at is currently the relief materials have reached, but now of late we felt that after review in India, the experts have felt that there is not much need for oxygen related equipment, because India itself has now made in these days self-sufficient, adequate quantities of oxygen for meeting the needs. And also we have said no to even ventilators. But there are certain items like ECMO machine or the medicines like whatever I just mentioned, 2-3 medicines. For that there is a bit of demand, which we have encouraged the community if they want to send it as a relief material. But our efforts in Washington are on for getting some vaccines. You must have seen all that the 50 to 60 million vaccines stockpile, which is not going to be used in US. That is what US is planning to distribute, and there has been a proclamation. So we are looking at it basically at this point of time that particular vaccine supply gap has to be bridged.
Thank you, sir. That really enlightens us on various aspects. And being in India and seeing everything that has been happening around with friends, family, acquaintances through the organization, I've seen that we had a crisis where we had to say, as medical professionals, we had to say no to every patient they were coming in that peak time, because there was so much overwhelming demand of even a simple equipment that we could not provide to the patient. It was really disheartening. It felt like the whole Delhi has gone COVID-19 positive at that time. So my next question is for Dr. Mahadevan. Dr. Mahadevan has been leading a lot of effort for India's public health crisis, basically the biggest humanitarian crisis in modern history. And it'd be great, sir, if you can tell us what was the difference that you saw during the first wave and the second wave of COVID-19, especially in India?
Sure. First of all, thank you to ICA for allowing me to participate in this forum, and it's a pleasure to be here with the Honorable Consul General, who I've had a chance to speak with on the phone early in the crisis, and also with Priyanjali as well. So the difference between the first and the second wave, just keep in mind, we know more about this illness every day. We knew less about it 1.5 years ago. We were only learning about it. So anyone who said they could predict that this was going to happen was only guessing. We had no idea. And so when the first wave came through India, the original virus that emerged from Wuhan, we knew some of its characteristics. We knew that it had a predilection, that it was more deadly for elderly patients, for patients with certain comorbidities. And as a result, there was an effort to lock down early, to send people back to their native places, to try and minimize the impact of the virus. And I think to a certain extent that happened. And over time, after the first wave hit India, we saw cases start to decline. What is a natural tendency of any human being? If cases are declining and the hospitals, I myself kept calling my colleagues who were in hospitals and ICUs throughout India, saying, "Are you full yet? Are you full yet? Is it getting bad yet?" And they said, "No, surprisingly not." And so there was this tendency as cases began to decline over time to feel as if, whatever it might be, whether Indians had a stronger immunity because of their exposure to other pathogens or the temperature or the circumstances, that India was not going to suffer in the same way as European countries had and the US had. That was just the general notion. And, and looking at the case counts, I myself in January said, you know what, I'm vaccinated now. I haven't been to India for a year. I think I will make a trip myself because things are doing so well. So even I was fooled. Then what happened is, as the Consul General has stated so eloquently, when a virus has an opportunity to be present within a population, what the virus will do is it will mutate into different forms. And that's been happening around the world. And some of those mutations don't work. And some of those mutations change the virus into a form that is more infectious and potentially more deadly. And because of travel these days, getting on a plane and traveling from one country to another, and the silent nature of this virus, this is something that I think it can't be said enough. This is unlike other viral illnesses where you walked through a screening tool at the airport that checked to see whether you had a fever or not. And that was the way they could identify you. Aha, you have the virus, let's pull you out. This virus is much trickier. Half of the people, and maybe more, honestly, that have the virus transmit it unknowingly to other people. That is, when you look at me and I look at you, you all look fine. And that's exactly the person that transmits the virus. They look fine. So what happens? You sit together at the dining table, you take off your masks, you have a conversation, and the virus is silently transmitted to another person. You have that combined with the desire in India, and let's be honest, throughout the world, to return to normalcy, to return to attending weddings, family gatherings, going to the Kumbh Mela, traveling throughout the country and seeing your relations or loved ones. And that all happened together early in the year, where there was this false sense of security. We can say that now, false sense of security, but at the time, we didn't really know. And you had people coming from all quarters, from all segments of the population, from all parts of the country, getting infected and then returning. And so you had, as Priyanjali mentioned, a humanitarian crisis because it wasn't Bangalore or Delhi or Mumbai alone that was impacted. It was the entire country at once. And as the Honorable Consul General has mentioned, we easily forget what was happening in New York just 1 year ago. The crisis on the hands, the absolute helplessness, the hospitals being overwhelmed. This is a robust health system that is there to manage emergencies. Now you have an Indian healthcare system that is not prepared to deal with the sheer number of cases. And that's what happened. It overwhelmed. And it happened in Wuhan as well. The sheer number of cases overwhelmed the system to the point where they had to intervene, build field hospitals, cordon off the area. That was the only way they were able to bring the mortality rate down in China. And that is what's happened in India. And here we are. It spread quickly throughout the entire population. I believe I said this earlier. Unlike the first wave, where some of us might have known somebody who died, I think this time all of us know somebody who's passed away, and it's a terrible tragedy. And now, as the cases have climbed and are starting to decline, this is not a time for complacency. This is a time to learn from what happened and prepare for an inevitable third wave. There will be. That's just the nature of this virus. We've seen it in country after country. But as the Consul General has said, the way to end the pandemic globally is to vaccinate the populations. There is no other way to end the pandemic. So all of our energies and efforts really have to go to immunizing as many people as we can. That is no small task. It is not as if you can go to the store and buy the vaccine off the shelf. It's very complex to produce. It can only be produced in small quantities because of the natural resources required. And it could take another year to produce enough vaccine to vaccinate everyone in India. So will there be a third wave? I hope not. But as we've been fooled before by this virus, I don't think anyone could say, and with certainty, whether they know or not. The assumption has to be that there will be a third wave and that we should be prepared for it is the most important thing. Rather than getting caught off guard, we should be ready.
Right. Yeah, absolutely. Very important points, sir. Indian healthcare system, as you rightly pointed out, when we started working, we had numbers where 10,000 patients in India are served by 22 skilled manpower. And that's why our organization focused on enabling the ASHA workers who are in touch with the community directly to screen for important women health diseases. But during the COVID-19 pandemic, even the society, the small communities where ASHA workers go door to door to collect data, they developed a sense of mistrust that they might be the agents of carrier or spreading the infection. So a lot of our ASHA workers got very, very demotivated. And I know two personally in Uttarakhand who left their jobs, who were very passionate to serve their society and have been very passionately working since years. So definitely the public health system needs rebuilding and rethinking because we have a population equivalent to a continent, not a country. So we need to work together and not feel that it's gone. My next question is for Honorable Consul General, sir. Okay, so this is really important for a lot of people in India who are looking to travel from here to India, from US to India. Can you tell us a little bit about the restrictions involved?
Thank you, Priya. So there are no restrictions on travel. No, even people now are traveling because no, maybe there's someone in near and dear is critical, or no, there's very emergent situation. People are traveling. Even we opened office on some weekends to give because we are not stopping. Only thing is, no, restrictions are like the quarantine procedures. But no, even if no, the frequent question I get from is no, I'm fully vaccinated twice, no, 2 jabs, it's all done. Can I go just like that? But no, still government of India and then the team in India has taken a decision that no, yes, you need to have a COVID-free certificate taken within 72 hours of your taking the flight. So that we are still following. Maybe it will be reviewed or not. No, it all depends on the experts in India. And on the quarantine, yes, no, after getting into India, if you have this certificate, no, they will ask you just no, be watchful about, and then no, they will track him. No, once no, they get out of the immigration. But as such, there is no quarantine to put again what we used to do during the first wave, 14 days into a hotel and then no, you don't come out. No, that thing is not there now. So people are traveling. There is no issue at all as of now. But I must tell you, just before second wave, I used to get around 250 visa applications a day. And just now, I'm not getting more than 15 to 20 applications. So that is the kind of difference I found during the, because people basically, as Dr. Mahadevan was mentioning, people really are taking care not to go and then get infected. Or even first wave, I must mention, many of the community members who have gone, came infected. But no, the lucky thing was, no, they isolated themselves, used same medicines, etc., not got hospitalized. At least I know half a dozen of them. But this time, people have not really traveled during this particular, until and unless, no, they are really required there. So that is, and today, as we speak, we have about 7 flights, including Air India, every week. But no, they are not fully going. And then while coming also, because of US restrictions imposed on May 4th, the people who are coming also, whoever gets that national interest exemption, they are able to travel. In some cases, US embassies and consulates are very kind, no, where they have on humanitarian thing, or no, to join the family, or to join particular job, no, where it is where it involves his involvement, no, critical. So in those cases, they are allowing. Otherwise, no tourist visas. As we have suspended tourist visas to India 1.5 years ago, they have also suspended now tourist visas. Otherwise, till the second wave, we were getting even no people who had B1, B2 visas coming and then staying here.
Okay, thank you so much. That really helps. My next question is to Dr. Mahadevan. So you're associated with the management during the second wave so closely. Can you tell us the data that is being gathered? By what percentage do you think is being underreported?
Yes, it's hard to say. I would say, look, you use your eyes and what you see in the news rather than relying on any figures. We know the devastation, right? We've seen all the cremations. We've heard from our family members. We've seen the number of individuals impacted. So, you know, any system that's designed to try and gather data is going to fall short, regardless of whatever country it's in. So, you know, the numbers speak for themselves. We can see what's happened on the news. We can see what we are hearing from our loved ones. And we can also track the positive case percentage, which I believe is coming down. So we know that it's run through the population because these variants that are there are very infectious and spread easily from person to person. So rather than dwell on those numbers, I think we should just assume the fact that it has impacted a great percentage of the population.
Right. Thank you, sir. So coming to the next question that I have for Honorable Consul General, has the Indian diaspora or any other group contacted you and your office for providing COVID-19 relief in India, which I'm sure you have already told us, but if you can highlight the points once more.
As I mentioned, Priyanka, no, the overwhelming support. I can tell you from the day one, we used to receive messages on how to, and particularly Bay Area, the big tech giants like, you know, Google, Microsoft. Other day I had a briefing session from Salesforce. All these companies have come out openly and they have announced their huge relief plans in various ways. Some people have attached themselves to the NGOs like Give India, Goonj, so various other ones, and they have channeled through different modes. Some people were transferring cash through the NGOs in India, wherever there is a death in the family, etc. They were able to trace and track and then help them. And then, as you rightly mentioned, the hospitals, the makeshift hospitals, some people have helped in that, and oxygen generators, people have helped. Even California governor has sent a flight load in the beginning of the thing, including some oxygen generators which were being used and later on publicized in the media also in Delhi. The community per se, I'm telling you, even today people are sending things. We are saying now there is no need for oxygen because now procurement also was difficult for them. The concentrators, etc. Suddenly they got over. 10 liters is over, 5 liters is coming. So that way. So, but people are so passionate. We are really thankful from core of our hearts, the way they came out. And some doctors in Bay Area and IIT, they have had a platform to give some consultation to those to take care of themselves at home itself. So that is the kind of help which has an RP, the Association of Physicians of Indian Origin, and there is another one, Federation of Indian Physicians. So all these have come together and then really helped up a lot. And then industry associations. I think businesses like several businesses which didn't have openly individually gone out like Google or Microsoft, they have gone into an organization called USISPF, United States and India Strategic Partnership Forum, or US India Business Council. All these people have really contributed in their own way, and I don't want to quantify the aid, but it's huge, and then that itself shows how much passionate they are about India, and overwhelming support, I can just say. And we were unable to handle in the beginning, but later on, yes, we could guide them, we could facilitate. We are happy that because they are all interested in whether my assistance has reached that corner or not. So that is what they were looking at. And then I'm happy to mention that in most of the cases, things have reached. Maybe people might tell you in the beginning there were some issues, some difficulties, but later on everything got streamlined. Thank you very much. And then all the community, and then ICA, like you, so many associations with whom I interacted, everyone says we are still there to do something to send relief materials, or like what you are doing, ration, etc. People today I met some in remote tribal areas of Visakhapatnam, they have reached the aid in the form of medicines, in the form of rations. And because it is lockdown, and then they were unable to go, rickshaw pullers, etc. So it is amazing. People have done so much sitting here. Thank you very much.
Thank you, sir. Coming to a really important question, which I think Dr. Mahadevan, you can enlighten us with. What can be precautions moving forward, considering the fact that vaccination, considering the vaccination is going to take time? Sorry. Yeah. So I'll just repeat the question. Considering the vaccination will take time, what do you think can be precautionary measures moving forward?
Yes, this is a very important question because it is going to take, as we mentioned, and vaccinations are not going to happen in the next 2 weeks. It's going to take quite some time. So we have to behave as if others potentially have the virus and can pass it on to us. So the advice I would have is, look, if you don't need to be outside and in the company of others, don't go outside and be in the company of others. Reduce your risk. Wear masks, as we have been doing in the Bay Area religiously, and I think it's made a huge impact. Ensure that others that are around you are wearing masks. Know what the high risk situations are. High risk situations are enclosed spaces where people are unmasked, they're talking, they're laughing, they're singing, they're spreading the virus into the air, and you're breathing it. So indoor areas with poor ventilation, especially if you're unmasked. And I personally witnessed this when I go to India. I like to visit different forest areas each time, and this time I visited Bhadra in Karnataka, beautiful place. But in Bhadra, each evening, everybody would gather for dinner, each family, and together indoors, laughing, talking about the day's events, what you would normally do. But I would take my food and go outside and sit by myself and eat there because I knew that was a high risk environment, even though I was vaccinated. So understanding what is high risk and what is low risk is important. Low risk is being outdoors, even if others are around. As long as you're moving and you're walking, it's almost impossible to get the virus. Good hand hygiene, I think, is really important. And also, finally, just not letting down your guard. Look, we're all human beings. When you're sitting with your loved ones, you're visiting family, remember that you may be asymptomatic but carrying the virus. So when you go to visit your mother or your father or somebody who's elderly, or even somebody who's going to come in contact with those elderly individuals, you're putting them at risk. So try and minimize that until we know for sure that we're able to get everybody vaccinated. I think, even for us here in the Bay Area, even though things are looking very rosy, no vaccination itself is 100% effective. There are going to be people that are vaccinated that will contract COVID. So to the extent that you're comfortable, continue to exercise caution until globally we have reached a point where we can all feel secure. I think there's no harm in that whatsoever. So that would be my advice.
Thank you, sir. My next question is to Consul General. I think this is a continuation of the previous question, but is there anything else that the Indian diaspora, especially in US and Silicon Valley, can do more to help? I'm sure the vaccination drive is the focus, but if you can highlight what can the community do to help, and if there's anything specific that you're looking for.
No, as I mentioned, no, they have been doing more than enough. In fact, the time they spent, particularly, I have seen some groups, no, they were spending really quality time on sending relief materials. Now, no, the Indian community is so strong here, and they have been approaching the congressmen, senators locally to see that no, we need the urgency of bridging the gap in supply of vaccines for these 2 months. So you heard that no, we already have vaccinated 230 million in India. But no, that is, our population, as you said, continent, it is 1.34 billion. So particularly to contain, as Dr. Mahadevan has mentioned, the vaccination of people will reduce these mutations, etc., and then will help us know to, as he was mentioning, now the age is different. No, we got to know people who are in 30s, 40s, getting infected and succumbing to it, and maybe next they say no children. So this is most important phase wherein we would like to vaccinate maximum number of people. Today, Honorable Prime Minister has made a decision that it will be 18 plus will be given vaccinations from 21st of June, that is International Day of Yoga, and 7 companies have been given licenses. As you know, earlier only we had 2 companies producing these vaccines, whatever we gave 230. Now 3 vaccines are approved in India, that is Covaxin, Covishield, and also Sputnik. And then there is one company, Biological E, and then it has tied up with an American company. I think Dr. Mahadevan will be able to tell more. I think it is a different platform, DNA platform or so. So they are going to start their manufacturing. J&J have tied up with India to manufacture J&J, because it is single dose vaccine, and then people thought it will be better to go ahead. So all these the production ramped up in maybe by September, October. You will be having enough to and then India is not new to administering vaccines. We have ran so many vaccine programs, immunization programs successfully. I think once the availability is there, I think people will be able to get vaccinated as soon as possible. As Dr. Mahadevan mentioned, you can't do it in 2 weeks. You saw US when they started, and then know what is going on now. And so in our case, you can see that the 230 million in such a short time was a big task, but it was achieved. We feel that it is achievable once we have regular, constant and continuous supply of vaccines. So there, the community is helping there also. They are reaching out to the political system and administration here. And I think now we have reduced, as I mentioned earlier, we were telling the community members here, yes, you can send concentrators, you can send BiVAP equipment and oxygen generators. And now we are only ventilators also. Now we are looking at only the kind of oxygen generating equipment. That's it, and then some medicines. But not really we are discouraging masks, etc. Several people come to us, we are going to send 5 million masks, etc. But now India, during the first phase, has really ramped up production of PPEs, and then this one, and how much the pharmaceuticals the production was ramped up when hydroxychloroquine was on demand. I was in India in Gulf division. Every Gulf country wanted so many tons of or quintals of the active ingredient of these medicines. So at that time we did. Now hopefully as the time goes, the vaccine production will be ramped up. I think all the best wishes from the community are so important, but the passionate work they have done cannot be forgotten.
Thank you, sir. Dr. Mahadevan, this question is really very close to my heart because we are addressing chronic diseases in rural areas. And with the surge of COVID-19, all the healthcare facilities are so overwhelmed that the normal diseases, the chronic diseases are not getting addressed, or they are getting even worse in numbers now. In 2020 itself, WHO had released a report saying that 130 million Indians will have cancer by 2030, which is 7 times the population of a city like Mumbai. And the comorbidities, we have seen what the repercussions has been with COVID-19. So do you think a parallel wave or parallel pandemic of chronic diseases is happening silently? And what do you think we should be doing about it is my question.
Yeah, you raise a very important point, and for all of those who are unaware, Priyanjali is doing incredible work in cancer screening, identifying. We know for certain the earlier you intervene in any medical condition, the better the outcomes. So if we wait until somebody has severe COVID or late stage cancer, unfortunately, there's less that we can do. If we can identify them early, especially cancer, we can save people's lives, and especially COVID, I would say as well. So hats off to you for all the work that you've been doing. And you raise a very important point, which is we can only give our attention to so many things at one time. And right now, COVID has grasped our attention, but it's also sort of brought forth the non-communicable diseases in India that are contributing to the morbidity and mortality of the illness. And that is those patients that we know so many Indians have diabetes, high blood pressure, chronic kidney disease. These are not only things that can harm you themselves, but also put you at risk for higher death rates with COVID. Obesity, smoking, cancer, immune diseases, all of these things. And so, of course, we will need to turn our attention once the pandemic has been brought under control. We'll have to turn our attention to these illnesses because they are also killing people. They're just not getting the press that COVID is right now.
Absolutely. Thank you. Yes, so Honorable Sir, the question is about what are the concerns for you and for the government of India right now that you might have noticed in the second wave, and going forward to tackle upcoming waves, if at all they come? What are the concerns for you from government perspective?
I think the main concern was don't get lax after the wave. That I think everyone now understood the devastating effect it had. So I think most of the people, as Dr. Mahadevan was mentioning, this time everyone is careful. Not that I got vaccinated and then I'm moving out without any mask or shaking hands or without any hand wash, etc. So I think that has been taken care of. That is the main concern. That is what happened after the first wave. So people just became complacent, and that has resulted in this. and one never predicted. I think in India, including the scientists who were the task team, which was COVID task team, which was dealing with it, have never expected the kind of surge. No, it was not predicted. So that is what now. But now we have learned lessons. I think it will be very cautious approach, and the main focus, as I mentioned, it's all just vaccine and vaccine. So government is looking at, I think we will be able to succeed in vaccinating maximum population, if that is the case. But no, I heard something from Dr. Mahadevan, no, one has to even look for, no, this is not the end of it. So we have to be careful, but at the same time, in our hands, or in our at our disposal, it is only vaccination which has to be done, including the children, because no, some reports have come that no, they may be impacted. So the government is fully understood the situation, and I think they are geared up for the vaccines production and also vaccination. I think that should take care. But no, see, Dr. Mahadevan should correct me. The wave, I don't know whether you can completely avoid a wave, but no, yes, no, you can reduce the devastation effect of the wave. So that can be done through all these measures, which we have to take till that time. So that is what I feel.
Thank you, sir. So my question to Dr. Mahadevan is that the professional community in the US, especially in Bay Area, what is your perspective? What do you think has technically gone wrong in the second wave? We know a lot from the press, but it would be great if you tell us what technically do you think was wrong in the second wave with the virus?
Yeah, it was a whole bunch of things that happened at once. One is, as the Consul General has mentioned, there was complacency to some degree, but it was not just that they decided to be complacent. It was following the trends over the prior 8 months. It looked like things were getting better, and so that complacency was not born of ignorance. It was looking at what was happening and saying, "Hey, I think we're okay." So that was number one. Number two is one that can happen anywhere in the world, especially with natural disasters, which is the demand exceeded the supply, like it's never happened before. This is an interesting illness in that the life-saving medications for this illness, the two life-saving medications, are steroids and oxygen. And oxygen, and it's unlike other illnesses where it might be antibiotics, which are the life-saving medication. But in this case, it's oxygen. And the requirement for oxygen across India far exceeded the ability to provide that. And that was not to be expected. Obviously, now with the introduction of oxygen concentrators, with shifting of industrial production of oxygen to healthcare facilities, that has been addressed or is being addressed, but we don't know what the next disease will require from us, whether it's a medication or oxygen or something else. It's hard to predict. But I think those two things, the sheer numbers that resulted from this feeling that 2021 was going to be our good year, 2020 was the bad year, right? That's what everybody was feeling, that now it's time to go to the weddings and start living life again. That happened. It happened in all quadrants. And then as a result of this illness, because it transmits silently, the demand far exceeded the supply. And that's what a tidal wave is. Remember, a tidal wave comes and crashes and then it dissipates. That's what's happening now. The tidal wave is dissipating, the cases are coming down, but that doesn't mean that it can't happen again. And that's why we have to be very vigilant and study what was just happened and try and prepare as best we can for the third wave, vaccinate as many people as we can, and get things in place such that if we need field hospitals, we can raise them quickly. If we need oxygen, we can divert it quickly. If we need medications, that we have a stockpile that we can go to, or resources outside of the country. I think those are the kinds of things that we're doing now to help prepare India for, or and another country as well, for the next wave.
Great. Thank you, sir. I think we have a lot of questions from the audience today, and I see a lot of engagement happening, especially around the arena of vaccine. So I think we should take up some questions from the chat. And okay, so I see a very important question, which is about what is the prevalence of vaccine hesitancy in India? What are the cited etiologies? Given the importance of widespread vaccination, what is being done to overcome this? Okay, so okay, so Consul General, so if you could take this question, I think this is really a very important question for everybody.
I think working in the medical field, you will be better in a better position to answer. We have been only watching the news. But as far as I know, I think there is slowly an education program going on vaccine hesitancy. I did watch in some news channels that know how people are saying no, but no, slowly people are getting educated, and then at the highest level, the messages are going to public that no, it is important to get vaccinated, and then there are no side effects, whatever rumors. No, I'll tell you, live about India. In about 3 weeks or 4 weeks back, I suddenly heard from media here saying that no, there is an Indian variant, and then people have got into one particular hospital in Fremont, all Indians. So I was shocked. The media was asking. No, I said I have not heard Indian variant or kind of thing. So then I inquired with that particular hospital. You don't believe that hospital put out next day a notice, on their Facebook, on their press release they have issued, saying that no, there is no increase in number of patients, of COVID patients coming into this hospital, particularly whatever community you are referring to. So this is the kind of rumors. Maybe in India also, somehow these rural villages, rural areas, maybe there is some misconception. I'm sure it will go away, and then people are educating, and then I think, like you said, ASHA workers, there was some misconception, but ASHA workers did a great job, during the first one. That is how you controlled. It was one of the factors to control in rural areas. No, you have to stay inside, you have to wear mask, and then you saw some people about the largest slum in Mumbai. People said no, the infection. So there also these workers have gone and helped. So I think rural areas, I think we will overcome that hesitancy factor. I think the people have understood what is there, why in their minds, and then started educating them in the rural areas.
Sorry to
Thank you.
interrupt here, but Priyanjali, what do you think? I mean, more than us, like the Consul General said, you're in the grassroots. What is your opinion about this vaccine hesitancy?
So I think Sir has already mentioned that the education program is going to play a vital role. We are trying to help through normal messaging in local languages to take one by one the myths around vaccination and send them in the form of SMS, because the smartphone penetration is still limited in rural India. So that is something we are doing through SMS. And another thing that is really vital is the role of ASHA workers here, because they are the community leaders who are constantly in touch with their community, and people have a trust. They trust them a lot. They know them. So education program through ASHA workers will be very good and effective, as I believe. And they need a lot of support from us. So I think that is a key area to look into.
I think you've highlighted something that's really important, which is we can stand on a soapbox and say that it's safe, but ultimately it's within your own community, trusted individuals within your own community that are going to be able to convince people to get vaccinated. And unfortunately, we're in this age of the University of WhatsApp, which is basically sharing its information with everyone. And unfortunately, they're not listening to the real universities, but to these universities. Even here in the US, you'd be surprised how many people cite misinformation. But the numbers don't lie. And what's happening right now in the Bay Area is incredible. It really is incredible. If you think about what was happening just 6 months ago, it is transformed. The number of cases we at our hospital have had days where in the emergency department, we haven't had a single positive COVID test in a 24-hour period. Can you imagine that? I couldn't have imagined that just 6 months ago, but we've gotten to that point. And why is that? Vaccinations. No two ways about it.
So, Reshma, I think we should talk to Priyanjali offline, see how ICA can help on this education program.
Sure. Priyanjali, please continue.
And Dr. Priya, I think there is some innovative and creative programs. Yesterday, I think there was a song by Shankar Mahadevan, No Tika Lagaya. No, this time,
Yeah.
this really get into the mask.
Yes.
So I think we are at it. Yeah, I think we are at it.
Yes,
That's very good.
absolutely. Absolutely. And there is really something, a very important thing that is happening in the community. I saw the other day that in a village where the predominant population is Muslim, they were announcing with followed by azan in the morning and evening that please get vaccinated, which really pushed people to take vaccine. And that was such a positive way of merging religion and the humanitarian crisis together and sending a message out. That was really beautiful. So, yes. My next question is to Dr. Mahadevan about, that is also a question that I have in my mind. So there is something really important in the news that has come up about a new hybrid, which has come in Vietnam. And also there are some rising cases being reported in the United Kingdom. So do you think there's a new variant now which has come out, or is it the Indian variant which has reached Vietnam, or what is the scenario like?
We can only go by the numbers and what we see. So for all of those that are here, the Indian variant is in the Bay Area. We shouldn't call it Indian variant. We should use these Greek names now, but all of these variants are here. They are here. And once a variant arrives and is spread from person to person, there's a delay when you start to see people tend to succumb from the illness at 2 to 3 weeks after getting the infection. Yet we are not seeing it. So there are laboratory studies where you can study whether you think a vaccine will be efficacious or not. And there's the real life studies. As I mentioned before, no vaccine is 100% effective. But to this point, from what we have seen, the vaccines have been effective against all the variants that we have seen so far. Could there be a variant that evades vaccine that requires a booster in the future? Absolutely. The longer that the virus is allowed to change and mutate, the greater the chance is that it could mutate into something that may evade the immunity that we've gained from these vaccinations. That's absolutely true. So even though there's a joy and there's a hope that we've turned the corner, we have to be vigilant, just in the same way India will be vigilant about a third wave. We in the US have to be vigilant that it's possible that this vaccine may not be able to tackle every variant that comes. We just have to wait and see. The good thing is we now have a technology through this mRNA vaccinations where fairly rapidly, now that all of the studies don't need to be done again and we have to wait months and months and months to know whether it's safe or not, where we can develop boosters and get them out to people fairly quickly once that variant comes. And that's going to be our way into the future of, just in the same way that we have to get influenza shots every year, it may be that we're getting COVID vaccinations on a yearly basis. But this is a global crisis. Until we take care of the rest of the world, we, no matter where you are, will always be at risk as an entire global population.
Thank you, sir. My next question is to Honorable Consul General. There are a few questions in the chat box. related to visas. I know you have addressed it in detail, but there's a question, only X visas or entry visa is valid. So people are really confused about business visas being valid for travel to India. So can you tell us what visas are valid and what are not for traveling to India and from India?
Yeah, Dr. Priyanjali, this one, visas are suspended, actually were suspended last year when we started lockdown. And even today, all the tourist visas which were issued and e-visas remain suspended. When the first phase was over, and then there were push for economic growth and all that, we have started to issue business visas. And some people who have taken earlier e-business visas have become valid. So now only visas which can allow you to go is entry visa. Entry visa is called X visa. Some people in US might have taken 5 years back a 5-year X visa, multiple entry. No, they can travel. But only thing is tourist visa people cannot travel. And we have started to issue even employment visas. Some people were employed from here in India, we have issued. So to be very clear, no tourist visa is valid. Even if you have a valid multiple entry tourist visa sticker on your passport, or if you have a 10-year e-visa, which is tourism, please don't go to airport. Come to a consulate. On our website we have given entry visa banner very prominently, and then just apply for that, and then some we give in a day or two. In case of emergencies, we have issued in an hour. So please go through that guidance given under the entry visa, and then you can travel to India. That's not an issue.
That's really helpful, sir. Thank you. I don't see any more questions which have not been covered. So, Padma, can you tell us if you have any other question that has been posed to you directly?
Sure. Thank you. Thank you, Priya. And thank you, Honorable Consul General and Dr. Mahadevan. You have elaborated very well, the situation and what we cannot do. I just am trying to post. You have helped us to understand what we need to continue to do. There were a couple of questions about black fungus and heart. I'm sorry, I have not read up about it, so I will just read you the question and hopefully you can help answer it. Um, here is a here is a member who wanted to understand how, despite a high RT-PCR of about 27 and no steroids or oxygen as a part of home treatment and no outward signs of black fungus, is there a possibility of the heart getting impacted even if the echocardiogram is okay? And I think there was a related question which talked about what is black fungus or can it happen? So
I can take that.
thank you, Doctor.
Sure, sure. So this black fungus is also known as mucormycosis. It is an infection that people with compromised immune systems are at risk for. They were at risk for this infection. It's fairly rare, even before COVID arrived. And the kinds of patients that were going to get the infection are those diabetics, poorly controlled diabetic patients who have high blood sugars, so poorly controlled, those taking immune suppressing drugs like steroids or other immune suppressants because of their other conditions that they might have, certainly were at higher risk. I think what we saw happen in India was that steroids were found to be effective for the later stages of COVID, and you've got again a confluence of difficulties. You've got sick diabetic patients who have poorly controlled diabetes who are now getting steroid medications, which also makes the diabetes less well controlled. Your blood sugars will go high, so you're making it worse to some degree if it's not managed carefully. and you've got situations where the hygiene may not be the best. So you take those three things, and in some cases, the dosing of the steroids was higher than it needed to be. You take all those things together, and you can see why there may be an increase in the number of these infections. And let me just be very honest. It's a terrible infection. It's a life-threatening infection. It is a disfiguring infection if it involves your head or your orbits. And many people die from mucormycosis once they get it. So should we be concerned? Absolutely. What can we do? Improve hygiene, improve glucose control in diabetics, use the recommended dosing of steroids, not going above that. In India, if X is good, then always people feel 10X is better. That's not the truth here. It's actually you want to stay with X. And those are then just be vigilant and make sure, not overly vigilant, but just be careful if you have any signs or symptoms to be seen immediately. Those are the things that we can do. And it's not going to go away even when COVID goes away. So it's something that we'll have to worry about even into the future. It's just come to light as a result of all of these poorly controlled diabetics in India. What Priyanjali was mentioning before, right? These are all these non-communicable diseases that have been sort of pushed to the side while we deal with COVID that are coming to light. They are important because they do cause problems. And these are things that we will need to address into the future. I hope that answers.
Thank you so much. I learned a lot. Learned a lot. And in a way, it's kind of scary, but I guess if people are looking out for some symptoms, if you already have the issues that you talked about, then maybe they could get help sooner than later and
Correct.
help themselves. So many of the questions, like Priya mentioned, you both have answered, several questions about how do we reach the rural areas? How do we educate them? But I think we would love to hear from you, Honorable Consul General, if there are any, planned training programs or something for health workers. Priya mentioned ASHA, but is there a plan to sort of train some health care workers to go out into the rural areas, help them get over their fear, help them understand the hygiene and everything that Dr. Mahadevan mentioned? Is there a plan possibly till, if it's going to take about a year for us all to be vaccinated and feel a little safer, in the interim, what is there a plan, or could there be a plan? I know India is such a large country, it's such a big population. Trying to reach every corner may be hard, but we'd like to know if there is a plan or if we can make a plan.
As of now, I really don't know exactly whether there is a plan, but I think when you roll out a vaccination program, you need personnel. I think even in Bay Area, some doctors and then the IIT forum, when they sat together, they were thinking of training online, people to train, for example, usage of ventilators, and these personnel were in shortage at the time, as Dr. Priyanjali mentioned. We were 22 for so many patients at the time. So, but it didn't happen at the time because the objective was to control at the time. Whatever is there, let us control first and then move on. So maybe when the vaccination program rolls out, then there is a requirement of personnel. I think Government of India will take care of new training program to induct people. So to achieve that vaccination, maybe it is important.
Wonderful. That helps you, makes you feel better. That there will be some plan to help and make this move become better soon. I think, Priya, there was another question about, at the beginning, I listed a few of the items that NGOs have requested of ICA, which ICA, through the funds raised, we've been able to help them with. But is there is there a place where we can find a list of things people want, or equipment, maybe state-wise or a few states together?
Um,
Again,
because,
this is for Dr. Prasad.
yeah, because of the request from the community, the government of India first listed certain items,
Okay.
starting from ventilators, and at the time we conveyed. Later on, the list has been shortened, and then we have added. For example, first we were only looking at remdesivir, and then later on we had added tocilizumab as a medicine which needs to be sent. Later on, now recently we add for black fungus amphotericin B or something. So these are all added. But at present, as I mentioned, the list has come down to only the oxygen generators, not the concentrators.
Mm-hmm.
And ECMO equipment, I think doctors will know better. I think it's a huge equipment which saves life. And also these three medicines, they are on the list. So if the community would like to procure and send them, and we have centrally one agency, Indian Red Cross Society of India in Delhi, which takes the delivery of the relief items and then passes it on to a Ministry of Health, who will distribute based on the need.
Okay.
To all the corners of. And then there are some associations who want to send to particular place where they received a request from.
Okay.
So that, but no, at present we are not taking masks and PPEs, which the government has reviewed, and then there is no need as of now. That is what we have been told. Only these three items which are required in India. So as of now,
As of now, okay.
the list may grow, the list may get short.
Wonderful. Thank you very much. And I don't know if there are any other questions, or else maybe I would like to request our president, Reshma, to share her closing.
Thank you, Padma. Thank you all for a great forum. As you can tell, we've never had such an overwhelming number of questions being asked. Thank you, Consul General Prasad. It's been wonderful. It's wonderful to know you and to know that we'll feel free to contact you when we need help. And the community now knows you, and it was in a very nice, gentle manner that you answered all our questions. So we thank you profusely for that. Dr. Mahadevan, what can I say? You are the guru. You've helped. You are constantly understanding, reading, learning. I'm sure every one of us has been educated by your answers, and I hope ICA can call upon you for help in advice when we are looking for what to send, where to send. Priyanjali, it's been delightful. Thank you very much. I know you spent a lot of time preparing for this and sent the questions and put it all together. Thank you very much. And we thank you for the work that you do in the grassroots. If ICA can help you in any way, please let us know. Similarly, Dr. Prasad, I hope we can count on you to call us when you need any help. We can, get a lot of things done very fast. But right now, I think it's time to let you all go. So thank you. And I am sure we will meet you soon. Thank you very much. Thank you to our audience and to the ICA executives and members who are all here. Thank you, Padma.
Thank you.
Bye. Thank you. Thank you.
Thank you so much.
Bye-bye.
Thank you. Thank you.